We are very excited to have Hannah Kleinfeld today on the podcast. And Hannah is the co-founder and COO of Omni-biotic US. There's so much misinformation and so much confusion, and I can't wait to dive into both gut health and how to really fix your gut with probiotic. I'm going to give a little bit more information about you because you are definitely not a low achiever. You were just going a million miles an hour. And then you got Lyme's disease and it just depleted you and you started to try to heal yourself. So this is going to be about how you healed yourself and really the gut. It
Yeah.
all came from the gut, and that created one of the best probiotics out there on the market. So we're going to dive really into that. But thank you so much for being on the pod today.
I'm so excited to be here. Thank you for having me.
Can you just let's go back out to the
Mhm.
Lyme's disease.
So I was about 2 years into my first professional life job in New York City.
In New York City, and so you're definitely not going out late or eating bad foods or doing anything that you do in the 20s.
No, I mean, I was definitely, loving life in New York City. I was also working a pretty intense job in management consulting. So, long hours, traveling a lot. And for the first 2 years, I was thriving. I was loving it, just feeling great and enjoying my professional career. And then about 2 years in, I just started feeling these weird symptoms creep in. And at first, everyone was
And
kind of
what were they?
It was weird. Like, I was always the one who got like food poisoning or like just felt off after eating out. And then I started noticing my brain just felt slower. I had to rely on my brain at work all the time. And suddenly things would take me longer. I started forgetting things. My workouts started feeling harder, even though I wasn't, doing anything differently. And yeah, it just, continued to get worse and worse over time. And at that time, I remember telling my primary care physician and my mom and some of my family members about this, and everyone was kind of like, "Yeah, you're probably just stressed. Everything is fine." Until, one day I quite literally couldn't get out of bed anymore.
And how did you know it was Lyme's disease?
At first, I didn't. I think I got a little bit lucky because a family member of mine in Germany had gone through this a few years prior, and she really urged me to get tested for Lyme. And then I also just got really lucky. I found an amazing doctor in New York City who was really at that point, honestly, specializing in tick-borne illnesses. He had a functional medicine background, was really treating people with these more complex conditions on a very holistic, full body approach. And that's really where my healing journey began. I worked closely with him and his team, and it was really a combination first of antibiotics, multiple antibiotics over 6 months to really kill the Lyme and the co-infections that I was dealing with. But then at the same time, also repairing and really building my health back up through nutrition, through other holistic means like acupuncture. I was really trying to take this full body approach. And, a big part of that for me was also becoming my own detective and really like reading and learning and asking the right questions, and at times also truly advocating for myself.
And do you think that the gut issues happened because of the crazy amount of antibiotics, or was it the Lyme's disease plus that? Like
Yeah.
looking back on it now, what do you
No,
think?
it's a combination of both. So essentially what I learned is Lyme itself can really target your gut and just lead to huge amounts of inflammation, deplete your gut microbiome. That was definitely an issue. Of course, the antibiotics didn't help. And then because my immune system was so weak during that time, and because I was dealing with all this inflammation, it also left so much opportunity for unwanted pathogens to grow, candida, SIBO. I've seen it all.
I
Yeah.
mean, I have friends in New York who have what you're describing. It's almost like they feel like they have brain disease. They
Yeah.
can't. One of my friends could not get out of bed.
Mhm.
I mean, she's like, but her legs stopped working.
Yeah.
I'm glad you had an experienced physician. A lot of times doctors confuse autoimmune disorder with Lyme
Mhm.
disease. So it's very important to rule out an underlying autoimmune condition,
Mhm.
which can be very, very
Yeah.
similar
Totally.
in the symptoms
Yeah.
and how they present.
Mhm.
And there is an actual Lyme disease test that you could take.
So oftentimes when people say Lyme disease, they actually mean a variety of tick-borne illnesses,
Okay.
right? Because a tick can carry Lyme, which is Borrelia, but it can also carry a bunch of other co-infections. And you can test for each of them through antibody tests and other lab work. And you can even do some more advanced, like genetic sequencing of your blood and detect kind of like the microgenes of some of these pathogens. But still, I think a lot of doctors don't really know exactly
Enough.
how this
Yeah.
works. And, even my primary care back in the day, she just ran the most basic tests that would have detected Lyme if I had just gotten infected. But the problem becomes the longer it stays in your body, the less it shows up as like an acute infection, which is detected by like some of these more basic tests. And that's really when you need to go deeper.
So, as a gynecologist,
Mhm.
I'm excited for you to be here because I see gut dysbiosis, leaky gut, IBS uh, in a lot of my patients,
Mhm.
especially because I treat PCOS and endometriosis. And I'm sure, I don't know if you know, but endometriosis patients have, a lot of leaky, symptoms of leaky
Mhm.
gut,
Mhm.
bloating, brain fog, weight
Mhm.
gain, fatigue, nausea. I mean, the list goes on and on. And I see the same gut dysbiosis with my PCOS patients. So, and unfortunately, doctors don't address it. And people, when you still talk about it to even physicians, they say, well, gut microbiome is a newer thing. It's really not that new. We know enough
Mhm.
now to know how to diagnose it and how to treat it. So I want to go back and I want you to maybe talk to us about our gut microbiome, how it protects us, how it affects our immune system, insulin resistance, inflammation,
Sure.
mood, all of it.
Yeah. So, as you said, there's a lot to unpack there. But the way I see our gut microbiome is a healthy gut supports a healthy life. And, our gut at the core, it's this world of trillions of good bacteria that are living in us and that are supporting everything from digestion to immune function to neurotransmitter production, mood. The gut and the liver are connected. So the gut is, supporting detoxification. It impacts metabolism. It impacts our hormones, which is so important, especially for women. It's really a control center of our health. And I think that's what is still a bit new. We're really starting to think about the gut beyond digestion and the immune system. But once we understand the power that a healthy gut has to support our overall well being, and also how an imbalanced, inflamed gut can actually counteract some of our other efforts in PCOS, in hormone balance, and so on, I think that's where we really find the power.
Because you deliver babies and you think the babies comes out and they have this beautiful perfect gut microbiome, right? And they have a little bit of their mom's, I
Hmm.
mean, more,
Yeah,
I
that's why
don't.
vaginal birth.
Right.
They
Exactly.
seed as they
They
come
Hmm.
through the
seed as they
vagina.
come through. I
Yes.
mean, you've done so much research on this as you were creating this
Hmm.
product. How do you know if it's IBS or if it's leaky gut or if it's or does it matter? Do you treat them all the same way?
No, I think that's a really good question. And, I think the first thing to realize is like, yeah, we start out with hopefully a good gut microbiome as babies, but also even that is impacted already by the mother's gut, right? Because
Right.
as you said, it seeds during delivery and then the baby continues to get good microbes through breast milk or just by being skin to skin. And then actually the baby's gut microbiome develops for the first 3 years of life. So anything happening in the first 3 years of life, the food, environmental toxins, antibiotics already impact how this little person's gut is kind of developing over time. But now, how do you address if you have had something? I would say, especially if you've had true issues, the best is to start getting at the root cause. Do a good stool test with a practitioner who knows about gut health, who really incorporates that as a core to what they're doing. Oftentimes, that is functional medicine doctors, nutritionists, naturopaths, and, really understand what is going on because IBS could be, that gut brain connection, but it could also be due to pathogens that you were exposed to
Mhm.
or something else. And if it's IBS versus leaky gut, often it's all of it combined.
Mhm.
You really want to make sure you understand what is going on so that you can then address it.
And So when you were going out to create this, you went back to your Austrian roots. Do you feel that what did you see on the market that
Mhm.
wasn't there?
Right.
And why did you kind of go to Europe
Mhm.
as your, inspiration for this?
Well, so, I grew up in Germany, lived in the States for a bit, lived back in Germany. So I was always back and forth between Europe and here. And thankfully, also in my own home, my mother, she was really into and interested in holistic ways of healing. And so that had always stayed with me. But then as I was going through the Lyme treatment, I was in Germany for my annual visit there, and I was talking to a doctor there. And I was kind of telling her how I had gotten frustrated here in the US because I had made progress in my Lyme recovery, but I still was so far from healthy. Brain fog, my digestive issues. I was intolerant to so many foods. I just felt like the Lyme was no longer there, but I was still kind of a shell of a human. And she said, Hannah, before you do anything else, especially in light of also your antibiotics for the last many months, you need to look at your gut, and you need to look at Omnibiotic, which is this new brand of probiotics that was taking the European markets by storm. And the more she told me about Omnibiotic, it's targeted probiotics. They had different formulations for specific health outcomes. It had clinical studies. I was really intrigued, and I started trying the products myself, and it was a game changer. My brain fog was starting to lift, which for anyone who's had brain fog, it's like you're living in a whole new world if that finally comes down. It was a real game changer. And that then kind of prompted the question, why is Omnibiotic not in the US? And for a while, I came back here. I was Googling, searching, seeing if a similar approach exists here in the US, asking my relatives in Germany and Europe to send me products. And eventually, when I was in business school, that question came back of like, why is Omnibiotic still not in the US? And through just an amazing connection of, people and events, we were able to meet the founders of Omnibiotic in Europe. And a few years later, we finally brought it to the US.
I want to talk to you about just the role of these our gut
Hmm.
microbiome, because I don't think our listeners understand. I don't think a lot of doctors understand. I'm not a
Hmm.
specialist on gut microbiome, but because I see and diagnose a lot of leaky gut in my practice, I've gotten better, but I'm no way an expert.
Hmm.
But one thing we know is that with the trillions of bacteria that live in our gut, when we take antibiotics, sometimes it takes weeks, months, or years to recover.
Hmm.
And some good bacteria are permanently suppressed when you
Hmm.
take antibiotics. And I want our listeners to understand that when there's a disruption in the lining of our gut, harmful substances start getting absorbed.
Hmm.
And by that absorption, then the inflammation goes up. And
Yeah.
that inflammation can have cascade of
Hmm.
events that can happen in our body. It can make our insulin resistance worse, so we start gaining weight. It can make us feel bloated. It can cause joint pain. It
Yeah.
can cause, and you know what, when it comes to women, it's important to know that, our estrogen gets secreted from the liver after it's processed into our gut.
Hmm.
And when we have a healthy gut microbiome, the healthy bacteria keep this estrogen in our blood in a way in
Hmm.
balance. They might excrete some or recycle it back
Hmm.
into our bloodstream. When there is a disruption in this lining, in this microbiome, what happens, we can have excessive chronic reabsorption of estrogen, which can increase inflammation. It can make
Right.
endometriosis worse.
Yeah.
For women with fibroids, chronically can make their fibroids grow. I don't know if there's a direct link to breast cancer, but that chronic extra exposure to estrogen can be problematic. And the opposite is true too. When there's a disruption, then you can start excreting a lot of this estrogen and not recycling enough of
Hmm.
it, which can affect your bones. It can cause vaginal dryness. It can cause hot flashes, brain fog, and all these other symptoms. So these are symptoms that a lot of us go through life and experience
Hmm.
it, but really we don't know that it comes from our gut.
Yes.
Hmm.
And we're so fast at taking antibiotics. I mean, I have patients, they call me once a week saying, "Oh, I'm sick again. I need a Z-Pack. Oh,
Hmm.
I'm sick again. I need a Z-Pack."
Hmm.
And I try to explain to them a common cold is a viral
Hmm.
infection. It doesn't need an antibiotic, but there's just so little information, and people don't really know the importance of this gut microbiome.
So a lot of this, when you say leaky gut, just to kind of go back for a minute, leaky gut, you can imagine your gut lining as kind of this wall of dominoes, and it's very thin. It's only one cell layer thick, which is crazy. And the point is, it's supposed to be thin so it can absorb
Back and
easily the
forth,
things
right?
from our intestine. But when we have inflammation in the gut, when we have an imbalance of bacteria in the gut, that wall starts to break apart. So toxins, or even honestly, bigger food particles that shouldn't get into our bloodstream, get into our bloodstream. That sends our immune system into overdrive, and it creates inflammation throughout the body. Nowadays, the kind of fancy term for that is low-grade inflammation, which you can see on lab work, and which then, interrupts our hormone pathways. As you just said, it can interrupt so many things, worsen insulin resistance, and so on. If we have inflammation in the body, oftentimes, especially over longer periods of time, it can actually lead to neuroinflammation, so inflammation in the brain. And that's nothing other than the toxins from our intestines reaching our
Mhm.
brain and leading to inflammation there. And that has been correlated in many clinical studies and much research to, mood disorders, brain fog, inability to concentrate, worsening even of depressive symptoms, and, as you get older, also neurodegenerative diseases such as Alzheimer's and dementia.
Even PMS is related to some of that, leaky gut
Hmm.
and that recycling
Yeah.
process of the
Hmm.
hormones. So many of these symptoms are related to our gut, but yet it's dismissed all the time.
Yeah.
From my personal
Hmm.
observation, I can easily tell you um, that 85% of my endometriosis patients suffer from SIBO.
Hmm.
That's how high it is. And these are patients who go from doctor to doctor and they can't get their gut fixed. But I try to explain to them that the underlying condition needs to be addressed.
Hmm.
So once you suppress your endometriosis and you bring down the inflammation in the pelvis, then you can go and treat your SIBO.
Right.
We always talk about how you don't want to take prebiotics for patients who have leaky gut.
Hmm.
And just to cover, let's say, SIBO, the most common symptoms of SIBO, I would say, if you're listening, is bloating, fatigue, weight gain, cramps when you eat food. You can have some nausea. Overall, patients don't feel well,
Hmm.
but bloating, bloating,
Yeah.
bloating,
Yeah.
bloating, even if it's not during their
Hmm.
period, is a main issue. And usually we avoid giving them prebiotics. I usually do the SIBO breath test,
Hmm.
then I treat them with Xifaxan if they
Hmm.
have it. And tell us where this prebiotic probiotic comes into play when you treat someone
Hmm.
with SIBO.
First of all, I love that you're doing the breath test, and I love that you're aware of that because, even for me, I was working with, a functional medicine doctor for a long time, and I kept saying, "Hey, I feel worse when I eat salad." Oftentimes, people with SIBO, they react to higher FODMAP foods, and, I was reacting to things like broccoli and Brussels sprouts and things in salads, and it took a really long time for people to even be like, "Wait a second, we think you have SIBO." And so I appreciate that you're doing that. But yeah, so what is SIBO? SIBO is it stands for small intestinal bacterial overgrowth. So it's the bacteria that are supposed to live in your large intestine that have migrated into your small intestine, usually because of inflammation in your large intestine, that are then growing and multiplying way too fast in your small intestine. And that creates the bloating, the extra gas, oftentimes also like a lot of like reflux and like
Mhm.
the just feeling really uncomfortable after eating. And the reason why you don't want to take prebiotics is because prebiotics are really food for any bacteria. And so if you're adding a bunch of prebiotics, especially prebiotic supplements, into this overgrowth
It's
and
just gonna be
it's
like
just going to be
lighting up
food. Yeah, you're
gasoline on fire.
exactly. And so that's why the first step should be get rid of the SIBO. Make sure you get rid of that overgrowth. And then it depends on the practitioner. Some will wait for the SIBO to be done before they even start introducing probiotics again to restore and replenish. Some will have found certain probiotics that they like to use with the Xifaxan or whatever antibiotic they're giving. And then you start rebuilding. The most important thing is usually with SIBO, there's a reason why you have this
Mhm.
overgrowth in your small intestine. And often that comes from your large intestine, whether it's inflammation or an overgrowth or something there too.
Endometriosis.
Right.
PCOS.
Yeah, exactly,
Yeah.
exactly. And so, you want to make sure that if you're giving the antibiotics, that you are then replenishing your large intestine to make sure that you're not creating extra inflammation or extra issues from there.
And why is it that we can't do it with food alone? Why do we
Yeah.
need to supplement
Yeah.
with
hmm
probiotics?
So I always say if you lived in a perfect world where you're farming your own food and you're not exposing yourself to stress or to anything else that would deplete your gut microbiome, you might be able to do it with food. And there are still some practitioners who primarily or predominantly like to use food. And I'm not saying, food is a huge portion of it, because if you're taking a probiotic but you're eating a bunch of junk food, that's really not going to be helpful.
Yeah.
And also, even sometimes, like depending on what's going on in someone's gut, these probiotic foods can also just be too much. It's almost like
Right.
if there's inflammation or something else going on. So the probiotics, especially if you choose probiotics that are science backed and have multiple strains that are well chosen, you can just be so much more targeted and mindful in what you're replenishing. And the way the gut works is we have 400 to 600 different strains of probiotic bacteria, or just bacteria living in our gut. Of course, you're not going to have a probiotic that has all 600 or 400 strains, but you want to find a probiotic that has these keystone strains, these strains that are essential to essentially build an environment for other good bacteria to thrive. And that is just so much easier to do through a targeted supplement versus like trying to eat a bunch of probiotic foods or prebiotic foods that will help build that environment as well, but it's just, not as targeted.
And but if my gut biome is
Mhm.
different than Thais's gut biome, so how is it that one probiotic can work for both of us?
Yeah. So it's different in the sense that we each kind of have a unique fingerprint of our gut microbiome. However, the same keystone, everybody needs the same keystone strains.
Okay.
If you think about it, you have a world of trillions of good bacteria living in your gut. So the probiotics will help create this environment for your gut to then, for all these good bacteria to
Right.
want to thrive and stay
Okay.
there.
You talk about estrobolome or the silent ways that cortisol chaos wreaks havoc on digestion. And you talk about gut inflammation, fertility challenges, PCOS, perimenopause. So can you go into that a little bit, how it affects all of those things?
Yeah, so it just, it goes back to what we just touched on already, that if there's inflammation in the gut, and that usually leads to leaky gut, that most of the time, if not addressed over time, will lead to low-grade inflammation in your body. And that has been tied over and over again to, disrupting our hormone signaling, disrupting our metabolic processes, accumulating toxins. So that's why we often see, and science has shown this as well, that this low-grade inflammation that often stems from dysbiosis in the gut is tied to, all these things that you just mentioned.
And I just want to add the same bacteria. That's a good bacteria that basically keeps our estrogen in balance from the gut. So when you have too much absorption or too little absorption, it can disrupt it. But on top of that, as you have leaky gut and you start absorbing these harmful substances into your system and your inflammation goes up. In case of PCOS, for example, there's a subgroup of women with their PCOS that the driver of their PCOS symptoms is inflammation. And that inflammation stimulates their ovaries to release more testosterone. And then the testosterone can cause irregular period, acne, hair loss, facial hair, body hair. But the driver is that inflammation.
Yeah.
So lowering that inflammation, helping that gut can help all of that.
Exactly.
Stress does
Exactly.
the same thing.
Yeah.
Right.
I
So it's
mean,
sort of
they're all
working in
connected.
tandem.
Exactly.
Also.
It's
You
all
can't
connected.
you can't just take a lot of probiotics and have this crazy stressful life that you're not dealing with at all with your cortisol levels. You have to kind of
Exactly.
Yep.
Yeah.
And what you do when you're so stressed out, correct me if I'm wrong, you make your healthy bacteria less active. You can also over time affect the diversity of these bacteria in your gut. So together, then it slowly slows down, especially with chronic stress. So I think all of it matters. I think reducing stress, sleeping, exercising, eating healthy. Like you said, if you're going to eat unhealthy, you
No
know,
amount of
Right.
probiotics
Mhm.
is really
Exactly.
going to,
Exactly.
you
Yeah.
can't, So can we talk about the differences between all of the different probiotics
Sure.
and what makes your product different than other products? And I really do there's so much confusion. Does it need to be refrigerated? Does it actually make it into your gut?
All valid questions. So let me start with what Omnibiotic is. So Omnibiotic, the real difference is that it is targeted formulations that address specific health needs. So it's not a one size fits all. We have different formulations that are different combinations of probiotic bacteria that help address things like your immune system, your gut liver connection, your gut brain axis, and we have the clinical studies showing specific clinical endpoints for each of these formulations. So that's at the core of also what attracted me to Omnibiotic when I first got to know it, because I could really tailor it to, let me first do a couple of months of Omnibiotic AB10 to restore my gut after antibiotics. But then pretty quickly I moved to the Omnibiotic stress release, which, nurtures that gut brain connection, which really helped me with my brain fog and kind of lift some of these also, cognitive things.
we did a podcast, I think about a year ago, and we talked about how some of these probiotics, by the time they hit the acid
Mhm.
in the stomach, they lose their function. Maybe, we were talking about this,
Yeah.
maybe some of them, by the time they get to our gut,
Mhm.
they're 7%.
Mhm.
They have
Mhm.
7% of the
Mhm.
activity that they had
Right.
started with. How do we know as consumers when we go to buy a probiotic, what is the active form?
Mhm.
Does it survive the stomach
Mhm.
acid?
Those are all great questions, and I think that's one of the things where oftentimes still now, if I talk to someone and I talk about probiotics, they'll say, I tried a probiotic, but it just did nothing for me. And then I ask them, oh, what did you try? And oftentimes it comes back to either just being like one strain, which in the grand scheme of things, if you're looking to shift your gut microbiome, usually you want multiple strains, or it was a product that perhaps didn't have the same efficacy or survival through the gut as some other products would. So for Omnibiotic specifically, our delivery mechanism, it's a powder. So it comes in these little daily packets. You dissolve the powder in water prior to intake. And then essentially what happens is these freeze-dried probiotic bacteria, they wake up, they rehydrate in this water. It's a neutral solution, so they're not being killed. And they find their favorite prebiotic foods in small amounts in this solution that makes them really strong. And that allows them to survive that harsh environment in the stomach and actually also in the first part of the small intestine. We've tested this in a GI simulator where we looked at 10 leading US brands versus Omnibiotic. For these 10 leading brands, the average survival into your large intestine was 7%. For Omnibiotic, it was 83%.
Isn't that crazy?
It's crazy.
Yeah.
7%. So
Yeah.
and
You're spending all this
that
money
and time.
and time, and it's like you said, in some instances
Mhm.
it's doing harm. When you get under the hood of the supplement industry and you see the garbage that is actually sold to women, it blows your mind. So I
Yeah.
mean, that's why I love having women
Mhm.
founders on here that have products that are backed by science. So what if you have all of it? What if you have bloating and brain fog? I mean, do you take 5 probiotics? Like how or you
No.
just work on one system at a time?
I mean, if you are experiencing a lot of these symptoms, I would truly start with a good stool test and probably, a SIBO breath test as
Yeah.
well on top of that, because you need to understand, like, where is this coming from? If you have inflammation in your gut because you have a pathogen like C. diff or something else, you can't even work on this inflammation until you kill off that
Right.
pathogen.
Right.
So I think if it's a lot of these issues, you need to get to the root cause. And usually that's not something you can just figure out by yourself.
Right.
And then, you work on first getting rid of the pathogens, restoring your bacterial diversity and your, just the overall environment, reducing inflammation. And that's really kind of what will set you up.
If you have to refrigerate a probiotic, isn't it true that the minute you swallow it and the temperature raises, obviously in
Mhm.
your body compared to the fridge, it inactivates the probiotic? Is that do you
Yeah.
know
It's
if this
tricky.
is true?
Like, it really depends. A lot of times, the reason for refrigerating a probiotic is essentially to kind of maintain them in this like hibernated or like almost hibernated state so that then when they do get into
I
your
see.
body, they are not like old, But the problem with that is, especially in places like Los Angeles or the summer on the East Coast, you just never know if that cooling chain was interrupted by the time it even reaches you. So you just don't know how many of the bacteria in this
Have
capsule
survived.
have survived before you even ingest them. So it kind of gets to the same issue of like how much is actually getting to me.
Got it.
Mhm.
So, what should someone look for in a
Yeah.
probiotic? For instance,
Yeah.
your probiotic, a clinical grade probiotic versus a generic one.
For me, any supplement I look for, whether it's a probiotic or just a supplement in general, I look for what are the clinical studies behind it. And are there studies on the actual product versus just like on one strain that was done in a lab somewhere on a mouse,
Right.
With Omnibiotic, all of our products have multiple clinical studies with specific endpoints that show that this actually works in humans. Number two, with probiotics, but honestly with all supplements too, is the delivery mechanism. How can I make sure that what I'm taking, I actually get into my body in a way that my body can absorb, in the probiotic case that it's alive and active. And then, yeah, I think those are really the main two. And then I think the third on, just to add to that, is with probiotics, but also with any supplement, you just want to make sure you're taking something that's actually addressing one of your health needs, right? Versus just because you hear something online or somebody
Right.
else
So it's
is taking
targeted
it.
to what
Targeted,
what you need.
exactly. Mhm.
So, for instance, you just talked about Omnibiotic stress release.
Mhm.
So you love it. It helps your brain fog. It helps your stress. Will you stay on it for the rest of your life, or is it the kind of thing that you think that you could heal your gut with a
Mhm.
probiotic and then be able to get off of it?
So the beauty of having different formulations, and that's also how I use them, is I really think what does my body most need support with right now? So
Okay.
right now, it's a busy time in my life. I take Omnibiotic stress release, but if there's maybe during the holidays or I'm like traveling and eating out more, I might switch over to Omnibiotic Detox, which is our gut, liver, and like metabolism support probiotic. And in terms of like, do you stay on a probiotic for the rest of your life or not? For me, it has become like a daily staple, just like my multivitamin. And if you think about all the different factors that are depleting our gut on a daily basis, our food, our water supply, the toxins, the stress, I think most people can benefit from incorporating a probiotic and some other gut support, like, nourishing foods, stress management practices into our lifestyle just for overall support.
And there's a lot of emerging data right now on gut inflammation and fertility.
Mhm.
What are the most important findings that women should know about this?
I mean, I think Dr. A, you already touched on it earlier. It's just kind of, again, understanding that oftentimes, fertility is so much more than just hormones. It's, the stress, the inflammation, the insulin resistance, and really also seeing the gut as part of that. It's, of course, not the only thing, but just realizing that I think a healthy gut can enable and support your healing journey. Whereas if your gut is still inflamed and you still have that low grade chronic inflammation, it can kind of sabotage your other healing efforts.
Especially, I would add that, PCOS and endometriosis are the top causes of infertility,
Mm-hmm.
and they're both highly associated with inflammation.
Yes, yes.
Endometriosis, you want to bring down the
Right.
inflammation. So
Mm-hmm.
you want to
Mm-hmm.
suppress the endometriosis,
Mm-hmm.
whether you do laparoscopic surgery to remove those
Yeah.
implants to
Yeah.
lower the
Mm-hmm.
inflammation, or you put patients on progesterone to slow down the growth of these
Exactly.
implants. Everything we do to heal PCOS or
Mm-hmm.
endometriosis as the two top causes of
Mm-hmm.
infertility partially is lowering
Lowering
that
the inflammation.
inflammation.
Yeah.
So anytime anything that can cause the inflammation to go up
Mm-hmm.
can make PCOS symptoms worse and can make endometriosis worse.
Exactly.
So that's why it's always, I look at the patient as a
Mhm.
whole, because you can't just go after one acne or throw birth control for PCOS. I mean, it can help with the symptoms of PCOS,
Right.
but it's
Yeah.
not addressing the root cause
Right.
of
Mhm.
PCOS. You have to figure
Exactly.
out what that root
Yeah.
cause is.
Yeah.
And that's why it's so important.
Mhm.
So when you say fertility, it's
Mhm.
everything we do everything I do, at least for my patients, is to lower their
Mhm.
inflammation.
Yeah.
So why not start
Yeah.
with the
Right.
gut?
And because estrogen, we've
Mhm.
talked about this a lot today, is such an important part of this conversation for women, Do you recommend different probiotics for different phases of your life? So would you give someone that
A
is
child.
a child or a teenager versus a postmenopausal or
Mhm.
perimenopausal woman? Does their gut need different things because their estrogen levels are so
Yeah.
different?
I think again it comes down to like more looking at their situation, you know, have they just been on antibiotics? Are they living this really high stress lifestyle? What is their GI test, like stool test saying if they have one, you know, to then or what are their other conditions like PCOS, insulin resistance, etc., to then come up with a plan.
And in terms of antibiotics,
Mhm.
do you take probiotics differently when you have antibiotics?
Yeah, so just like Dr. A said earlier, you know, even a very short course of antibiotics can have a lasting impact on
Right.
our gut microbiome. It depends again a little bit on the doctor in terms of the approach they like to take, whether they say first take your antibiotics, then take your probiotics. The way I like to think about it is even when you're taking antibiotics, it depletes your gut microbiome. So it makes sense in many cases to already start supporting your gut microbiome during this course of antibiotics, but then continue to take a slightly higher dose for at least another 2 weeks after that to kind of continue to replenish. One of the first formulations from Omnibiotic was the Omnibiotic AB10, which was specifically formulated to restore the gut after antibiotics and has shown in clinical studies to dramatically reduce antibiotic associated diarrhea and infections of things like C. diff during and after antibiotic intake. So for me, when I'm taking antibiotics, which thankfully I don't have to do often, I always go to twice a day Omnibiotic AB10 for about a month, and
Okay.
then I will kind of evaluate from there.
Amazing.
And I just want to add with menopause, because our estrogen and progesterone starts dropping, it definitely affects our gut. That's why a lot of women, as they go through menopause or they're in perimenopause, as their hormones drop, the diversity of their gut microbiome goes down
Mhm.
and the activity of these good bacteria go
Mhm.
down. So they tend to have more leaky gut, more insulin
Right.
resistance,
Mhm.
more bloating, more fatigue, more hot flashes, more brain fog,
Yeah.
more of these symptoms.
Mhm.
And there's some studies that say actually hormone replacement can preserve some of this
Yeah. Yeah.
bacteria in our gut.
That's a really good point because we know that as we age, our gut microbiome diminishes both in diversity as well as in count, which is also then related or connected to some of these early signs of forgetfulness and things like that, if you're talking really more like senior age, and why it's also so important to support the gut microbiome, especially as we age.
And I think I've told you this before, Thais, but my dad grew up on a farm
Hmm.
and in Tennessee, and he said they were always in the dirt, and they were literally like, he's like, I licked dirt all day long, like everywhere. Like we never washed our hands. We were, and we've now become a society, especially
Hmm.
on a
Yeah.
obviously after COVID, where we're, it's everything is like, what are your thoughts on that in
Yeah.
terms of children and kind of letting them play in the
Hmm.
dirt so they
Hmm.
get different,
Hmm.
you know, strains of microbiome.
Yeah. There is actually some interesting science that suggests that kids who grow up on farms or who grow up with animals and, you know, playing outside more, that they have a more diverse microbiome. And, you know, it's something I think about personally as well. I have a 2-year-old daughter. You know, how do we raise kids in today's world where they are less playing outside, more exposed to stressors and environmental toxins? How do we raise them in a way that still supports their long-term health and well-being? To repair the gut, it often takes months, sometimes years if someone had, you know, prolonged issues. For me, it was just after 3 days, I could start feeling that some things were shifting. And that was such an encouraging thing to experience. But yes, absolutely. You know, especially probiotics, they're not a quick fix. I like to think about it as a garden. You know, if you have a bunch of weeds and things overgrowing, you can't just assume that the next day you're growing vegetables. It has to be something that you're, you know, nurturing over time.
I love the
That's
idea of the
yeah.
gut as a garden. Your gut is a garden. You gotta tailor it and cut
Yeah.
it and make sure it looks great.
Plant
And
beautiful
nurture it.
Plant
flowers.
beautiful
Yeah,
flowers. I love all
exactly.
this amazing information. We're gonna let listeners know where to find you in our show notes. Hannah, thank you so much for being on SheMD. I mean, this is gonna be great.
This is really good.
Yeah. We covered a lot. Thank you for having me.
Thanks so much for joining us today on SheMD.
If you want to own your own health, a good place to start is by following us on social media at SheMD Podcast and by subscribing to our show on YouTube or wherever you get your podcasts.
For takeaways from today's episode, visit our website, shemdpodcast.com. We'll see you next time on SheMD. This podcast is for educational and entertainment purposes only. It is not intended as a substitute for a physician's medical advice. You should regularly consult your medical provider in matters relating to your own health. Even though we share our honest beliefs on SheMD, some of the products and services we discuss may involve sponsorships or paid advertising.